Can you speak a little bit more to, I guess, the stress put on by organizations like ACC in their meetings and in their agendas and topics on keeping patients from invasive care, from higher risk care as best you can? It seems like all the agents and tools and resources and practices and procedures and guidelines that we have in place now are really geared towards refraining from reaching that spot until it's absolutely necessary. Has that improved over the years in terms of the discussion and development of treatment?
Yeah, I mean, I think certainly valvular heart disease in terms of treatment has certainly gone a long way, as you mentioned. Surgery has been a standard for treating aortic valve disease for a long, long time. It's a mechanical problem. And TAVR has certainly really raised the awareness of these patients being presented earlier before they get into the kind of terminal stages. Having said that, I think one of the remarkable evolution of TAVR is that the safety and efficacy has gone a long way over the last nearly 20 years. And that's important to note, because if you have an invasive therapy, but the therapy, if it's not safe, if it's not significantly efficacious compared to the established standard, it's not going to get adopted widely. And I think the manufacturers and implanters in the TAVR have really come a long way in making this procedure very safe and very efficacious, and most patients go home the next day. So what we need to do as a cardiovascular community is to embrace technology, but make sure we embrace them with thoughtful, careful studies, and making sure the procedure is safe, but at the same time, at least as efficacious as the established practice. If that's the case, and that's what TAVR has shown, then patients will most likely choose the preferred therapy, which is the less invasive, which makes perfect sense, especially at the current state and age with such a pandemic going. No one wants to stay in the hospital for an unnecessary long period of time. But safety has to be number one, in my opinion.
Yeah, absolutely. There's so much adverse association with hospital duration, length of stay. And obviously, especially right now, there's such a stress on avoiding such places and such situations. So that's great to hear. And I guess the only other follow-up I would have is in regard to the manufacturer's role.
Yes.
How do you expect them as a professional and expert in your experience in dealing with this? Do you expect them to respond appropriately to these findings and to make the appropriate responses and adjustments?
Our group has already reached out to various manufacturers to alert them of this finding, because this finding, was part of this study, was previously published before, and we really trying to engage them and the engineers and research and development teams to come up with solutions, because we know that as TAVR expands and the United States expands, it's going to be even more next year to almost everyone. So to come up with these solutions in a more urgent manner, so that the next iteration of devices are no longer focusing on minute adjustments or improvements. We really want the next generation devices, and there are some upcoming players being evaluated in clinical trials. So there's a JenaValve or a JValve, which are independent companies, actually require commercial alignment for deployment. So the whole cardiovascular community, in fact, the most recent TCT and TBT meeting, there are already talks and presentations on this subject. So more and more cardiologists and TAVR operators and manufacturers are aware of this issue, and I hope that they are working on the next iteration devices to address this issue.
I like it. I like that as an optimistic note going forward. And let's end with one more optimistic note going forward. ACC 2021, hopefully we could be in person to talk about this and feel good and comfortable with that decision. Obviously, ACC had very measured reason and good response to what's happening right now to cancel the meeting and go virtual. But, next year in the live in-person meeting, I think it'll be the 71st annual, something like that. What exactly do you hope headlines TAVR discussion?
Well, TAVR is a very mature therapy now. So I think that next year, we would certainly like to see some of the study findings on durability, some of the findings on conduction abnormalities post-TAVR. Do they have an impact, short or long-term on patients? Because that's still an unanswered question. And then some more studies on imaging, because I think there's a huge opportunity to cardiovascular imaging in this field, not just on valve durability and valve thrombosis, but also on what we study right now with valve orientation and alignment, and does it impact any kind of potential durability issue as well. So these things might all be interrelated, and I think we would love to have more answers and questions come next year.
I like it. I like it. That's a great sentiment to end on, and I'm looking forward to those discussions already. I trust you more than anyone, I think, to expect them to be delivered. So here's to ACC 2021 and ACC 2020. So far, so good. I hope you enjoy the virtual sessions and discussions that still happen online as best you can, and stay safe. And we'll talk to you soon. Thank you so much.
Well, thank you very much for the opportunity, and hope everyone the best and have a good afternoon.